Forward head carriage, a fancy way of saying that the head is out of alignment with the shoulders and hips. The average human head weighs about 5 kilograms, about the same as a bowling ball. Now picture this hefty bowling ball perched on a stack of a small cervical vertebrae. Sounds precarious, right? Luckily, our necks are reinforced by layers and layers of ligaments and muscles and connective tissues that support the head, and despite its weight, are able to distribute the stresses further down the chain. There is in fact optimal position to the head and the rest of the body, and this is what we call plumb line. And the plumb line would go through the earlobe, outside of the shoulder, third lumbar vertebrae, outside of the hip, outside of the knee, and lateral malleolus, which is the bony prominence on the outside of your ankle. That is the ideal neutral. Of course, it doesn't have to be exactly in line, but roughly in this position, the body will be experiencing the least stress. But for every inch your head moves anteriorly from this neutral position, the effective weight of your head and the tension or stress experienced in the upper back region increases by about 4.5 kilos or roughly 10 pounds. So if your head is 3 inches forwards, just that little amount, your neck and shoulders are essentially lugging about 20 kilos. When your upper back rounds, your neck compensates by extending. Our brains ensure that our eyes and head stay level so we can keep the image of the world level. That means that our neck extensors, or the muscles at the back of the neck, and the muscles or the base of the skull working over time. What you may see over time is a little hump in the upper back region, just here, and increased curvature, like roundness to the thoracic spine. Your pelvis start creeping forward, and all this are the strategies and adaptation of the body to fight gravity, so we don't topple over, and also to dissipate forces away from any specific region and to distribute stressors across the whole body. In many cases, it could lead to chronic pain. So in today's video, we're going to dive into effective strategies and exercises to help with the discomfort. The muscles at the back of your neck and upper back, like upper trapezius and levator scapulae, will go into overdrive. That can make even just supporting your head in vertical position awfully tiring. And this will be this guy over here. You see levator scapulae. You see how high it goes. It goes literally to the level of C1 to C4. So it's the upper segment and lateral side of the neck. People just massage this area, but actually the cause could be around here. It's called superior angle of the scapula. And as you can see, it's a very narrow point. So if you palpate that area right at the tip, sort of medial scapula, medial shoulder blades, you may find a trigger point there. And unfortunately, you can imagine that when the neck is displaced and this moves forward, the muscle will be fighting to pull your head back. And that's when you've got the ache, something we call levator scapulae syndrome. And below that, we also have our rhomboid muscles. And these poor guys are often blamed, but in fact, they under a lot of stress, because imagine shoulder blades gliding apart. You're going into the round shoulder position. Your head is going forwards. All these tissues will be working over time. What happens on a physiological level, it means that constant tension of the muscle actually will create a bit of constriction of the capillaries in this region, right? The muscle is elongated and there's just not enough blood flow to the area and can cause kind of ischemic low oxygen state, which means that the muscle is complaining and generating pain. Studies have shown that actually different postures of the head and neck, anterior head carriage, thoracic kyphosis, any alteration in mobility of your neck and upper thoracic will impair normal breathing and also function of the diaphragm. So the mobility of the lower thorax during respiration was significantly reduced with the forward head posture. But guys, there are things you can do. So now we are moving on to the exercises, to little strategies for your neck, for your upper thoracic spine, and your scapula to help in restoring balance in this upper back area. Let's begin with short-term strategies, things that would bring you instant relief, like stretching. Stretching muscles that I mentioned before, your levator scap, your trapezius, and also your scalenes.
You will approach this with so-called METs. This is normally techniques used by manual therapists, but you can do little inputs like this by yourself, and that involves stretching the muscle, moving the origin away from the insertion, and then applying a short isometric contraction. After holding for a short period of time, then I'll be contracting the tissue, pushing into the hand for 5 seconds, and then I relax. The contraction making is very low level, about 20% of your max, and you repeat it about 3 times. It's actually a more effective way than just passively stretching the muscle. It actually will help you feel relief much quicker. Next, non-negotiable drill. Every morning and throughout the day. Neck circumduction. Basically taking your neck through its full range of motion. You go as far as you can in a controlled way. Lowering the chin, rotating the neck, looking up, sending your head back. Try not to reproduce pain. If there is pain, you go as far as you can in all those directions because the neck should be moving. You're trying to support the joints with movement. If there's inflammation, you're trying to help with blood flow to the area to decrease inflammation. The muscles will then also receive nutrition. Moving on to actual exercises, I would strongly recommend working on scapular stability and overhead work. I used to suffer from a lot of neck tension. You'd be always my right side, my dominant side. I've managed to overcome those recurrent aches with scapular training, scapular stability. And this is one of the positions I'm showing you here. It's the all fours. I'm actually working on rotator cuff and then overhead movement using the prone position. So when you're facing down, you can actually work on the parascapular muscles around the shoulder blade, and offset or stop overworking through that trapezius. I found this very beneficial to also limit discomfort in my shoulders from sitting at the desk for so long. Another drill that I would recommend again to repeat on a regular basis would be shoulder controlled articular rotations. Just taking the shoulder through a full range of motion in this prone position with a very light weight. I'm using 1.1 kilo in my hand here. You can work with holding your phone, even work without any weight whatsoever. So again, it stimulates and invites blood flow to those tissues that get that constriction and don't get enough perfusion when we sending head forwards. Exercise number 3. It's a prone position. I like to call it resetting because in here, I'm not really doing too much work. I'm just going to float my hands off the ground and pull shoulder blades gently together and down, just trying to lengthen through the neck, lengthen through the tailbone. My hands are reaching towards my feet. And that was a test done to me by a physio. When she asked me to lift my hands, she said, okay, how much weight are you actually putting through your head? And bear in mind that when I lifted my arms, most of my weight went through my neck. I could feel like my head is pressing into the plinth at that time. So this is the way to bring attention a little bit to from which area we're controlling. As soon as I float my hands and reach to the heels, I'm trying to squeeze my glutes. I'm floating my hand a little bit and just thinking of activation through the middle back. So you see how subtle that is. I found that released a lot of discomfort from anterior shoulder for me and felt like a nice break from sitting at the desk. And the final exercise would be breaststroke. And again, this is wonderful movement to get the rhomboids working, to get that scapular movement, to get the trapezius, but also upper, middle, and lower trapezius working. It also helps you to create a bit of extension in the upper thoracic spine. I'm trying not to lift my chin. Notice that if you have anterior head carriage, your neck is most likely in extension already. So here I'm actually tucking my chin in a little bit and I'm lengthening through the neck, but I am trying to send my breastbone and collarbone forward, sort of that area above the middle of the chest, send it forwards and up, not lifting my chin up or extending my neck. And a final suggestion, guys, very easy to do, and it's not only benefiting your posture, but it will also support your nervous system. This is, I call it like a breathing mechanics reset. You want to put yourself in a position where you can breathe with ease. Externally rotate your shoulders, you support your wrists, so you're not obviously uncomfortable in your shoulder joint. You put a blanket below the neck, give yourself enough support so your neck feels comfortable. And also put your feet up on the sofa, on a chair, on a bench, and let your body relax. You want to use your belly. So this is about also using your diaphragm. You want the breathing to be silent, very gentle. Inhaling through the nose, exhaling through the nose. The idea is to relax the accessory respiratory muscles and let the diaphragm do what it's supposed to do. I find it very therapeutic. All right, guys, and now I want to explain to you why I am giving you a position on the ground where I encourage you to breathe. Diaphragm is such an important muscle. It's the primary muscle of respiration. As you're inhaling, the diaphragm will contract and move down, flatten, because its natural state is more dome shaped. So as you're inhaling, diaphragm will move down. As you exhale, diaphragm will recoil. As you can see, is obviously the process of changing pressure. Inhaling, you're lowering pressure in the lungs. Exhaling, you're increasing pressure in the lungs. And diaphragm is such an important player in this process. So when you're lying down on the ground, we're trying to get diaphragm moving. You will feel belly going up and down. You also have muscles of accessory muscles of respiration, like your rectus abdominis over here, okay? And also internal intercostals, scalenes, and sternocleidomastoid. And there's also pec minor over here attaching to the rib 3, 4, 5 and to the shoulder blade. So it would go across here. And all these muscles, for many people, especially if you're a person that is very anxious or very stressed and keep going, you may get panic attacks, right? You will end up using this muscles a lot. And for a lot of people that are using accessory respiratory muscles, they will be actually breathing in the upper chest, right? We assess this in clinic by placing the hands over here. We're checking this first rib over here. We're checking the sternum, which is should be moving forwards and up and then back and down. And also we're checking the ribs, whether ribs are expanding in a bucket handle-like motion sideways. Yeah, this how the ribcage should be moving. But for many people, it doesn't move at all, or only the upper chest moves. Hence, that suggestion of lying down and just working on your breathing. It will benefit not only your body and your neck and upper back, but also your mind.